I'm Dr. Pasco Hearn. I'm a registrar in infectious diseases and microbiology at St Thomas's Hospital in London. In 2008, I went to Mbarara in southwest Uganda with my girlfriend, who's also a registrar in infectious diseases and microbiology. And we worked there in a medical school as visiting lecturers and also on the wards as medical seniors. I think the thing that made me interested in working overseas was that it fitted with my interests in medicine. I became interested in infectious diseases quite early on in my career. I think I wanted to gain that experience firsthand, where you see a lot of different presentations in a fairly short period of time, and just gain a whole load of experience that you wouldn't necessarily gain here in a year. The medical service there is run for free. There are government hospitals and then clinics that work at a number of levels of increasing sophistication, really, based on how rural they are. Patients would be brought to the hospital by their families, and so that was often very costly for them, and it would mean that they had to come long distances, and because there were no ambulances really of note there, people would come in shared cars and on motorbikes that they'd kind of hired or taxis, and so people would really present very late in their illnesses, which was very difficult sometimes. A lot of their personal care would be taken care of by their family. The nursing staff were there and would take observations and do drug ward rounds, but the family were really there to kind of help clean and feed and dress the patients. We were working with a lot of really switched on, bright medical students who'd gone through a lot to actually get into medical school, and were really keen to learn, and they really kind of pushed you to your limits, and you end up going and reading about the questions that they were asked. And so, I think it's definitely a two-way process when you're out there learning. It can be quite shocking working somewhere where you see a lot of young people dying from diseases that you may or may not be able to diagnose, some of which are familiar, and you're able to treat them within your limits. You may only have one drug to treat that particular condition, and so that you're seeing people succumbing to illnesses that we can treat relatively simply over here just because of the resources that we've got. Microbiology and infectious diseases is made up of a lot of illnesses and diseases that you see in somewhere like Mbarara. So for me, the experience is completely transferable. The skills that I got there I'm using now. I think in any specialty you're going to learn a lot, and it's not just about the cases you see, but the way in which you practice, really, the way you approach the problem of being and working in a resource poor setting. Getting over those kind of challenges is something that will help anyone. I think it's a bit of a myth to think that you're going somewhere doing something completely altruistic. You stand to gain a lot from these kind of experiences. You see a lot of infections, a lot of conditions that you wouldn't see here every day. You gain a lot of experience from the people you work with who have been living and working there for years. So that can only benefit you when you come back and you see those conditions here and you're a bit more comfortable and confident diagnosing and treating them. I wouldn't be put off by anything, really. There aren't that many obstacles to going away. It's very easy to be blinkered within your medical training and progress on to the next rung of the ladder and keep going until you're a consultant. But actually there are lots of points at which you can take some time away usefully and have a great time.